We all know that to kill a mosquito, we don't need any missile to launch. So, meniscectomy is a very simple and easy procedure which can be done for a meniscal tear, which we all know. Again, coming to anatomy in short, the meniscus, the outer 1/3 is most important because it is vascularized, and the inner 2/3 which is non-vascularized. So, there are problems with healing in the inner 1/3 part of the meniscus. Meniscal tear, usually the main complaint is pain and locking. Usually it is because of the loose part of the meniscus which comes in way between the joint. And the treatment we all know is arthroscopy. Either you go for meniscectomy or repair, depend upon the ideal indication of that. So meniscectomy, what is it? It is a resection of torn meniscal tissue, but the most important thing is a balancing of the meniscus to avoid the further complications. It is a choice of treatment since many years which every arthroscopic surgeon it follows. It can be done in all types of tears. There is no contraindication for the meniscectomy. There is no or minimal post-op pain because you are removing the part of the meniscus which is giving you trouble, which is less expensive. It doesn't require any meniscal implants or suture material. And we can immediately rehab the patient. We can start weight bearing from day 2 and you can start flexing the knee. It is relatively easy and not technically demanding because we all know when we have started our arthroscopy, when we start our doing first surgery, it is always with a diagnostic arthroscopy with meniscectomy. And then we go for ligament reconstructions and meniscus repair and so on. So this is the basic surgery which we all start from day 1. Principles, of course, we all should know that removal of only torn part of the meniscus is very important. So we can give more meniscus which is available for its function. Achieve a stable meniscus to avoid re-tears from the part which we have torn. Preservation of capsular rim, again important to maintain the function, and protection of normal cartilage while doing meniscectomy is also important. That is iatrogenic trauma to the cartilage. Meniscectomy, it follows the patient's and relatives' expectation because in our scenario or in a tier 2, tier 3 cities, usually when we put a scalpel on the patient, they want a 100% result. So what they ask, guarantee hai kya? So this meniscectomy usually gives a 100% satisfaction because we are removing the part which is damaged and which is giving you a trouble. So it's like na rahega bas, na rahegi basuri. So you are removing the part which is giving you trouble. So it almost gives 100% satisfaction. So what is meniscus repair, how it works? So we all tibia patient fractures, we usually first fix it with a cast, but when the nail comes in, we started doing nailing in almost each and every patient, even in an undisplaced fracture. So we got a new toy in surgeon hand, that is meniscus repair thing. And we all know, or all surgeons, we are very much enthusiastic of any new procedure which is coming in the market or any new instrument coming in the market. So it is technically demanding. Meniscus repair is 100% technically demanding and we should learn from a good expert hand, otherwise it leads to a failure rate. It is having a long learning curve because every instrument is having its own technique and fixation modalities. The efficacy we should know before you are starting in our private patients. Literature support 100% that is giving good results, and it is expensive. This type of meniscal tear, we all know it cannot be repaired. So for repair, yes, this is good, but they are having very certain limited indications. The tears, they have to be longitudinal tears, meniscus root tears or ramp lesions. The location should be in vascular zone. Age should be young patients. The time since injury should be very short or it should be an acute type of tears, and the patient should have low BMI. All these indications should be there to be followed. All new things in the market are always hot and sometimes they are market driven. So even if there are ideal indications 2, they tell us, boss, you can do it in these 10 indications, and these senior surgeons are doing and they are getting good results, so we follow them and we start doing. So we should select the ideal patient. Otherwise, we all know all the new hot things, they come with acute or late complications. So device misfire, it is implant related. chondral injury, because if suppose the implant is proud in the joint, it may damages the cartilage, leading to additional cartilage wear, injury to the collateral ligaments, nerves, IT band, etc. Longer recovery time because of unpredictable meniscus healing, and higher rate of re-tear in these cases. So, in review, the reoperation rate for meniscal tear is almost 16 to 20%, and the failure rate is almost 23%. Some of the literature they says that there are orthotic changes radiologically after doing meniscectomy, but the patients are clinically good. Some long-term results with meniscus repair and meniscectomy shows after 13 years also, the incidence and severity of arthrosis does not differ significantly in both the groups. So, with this technically demanding surgery, higher incidence of complication, we all know the cost factor which is very high. In our scenario, it is little bit difficult to explain the cost and the 100% expectation of the patient. If I suggest the patient to undergo meniscus repair in all patients other than ideal indications, then it will be like Abail Muzemar. So I am getting a boomerang on me. So the take home message is meniscectomy, can be done in all tiers. Technically it is less demanding. It gives a good predictable results. It is less expensive and we can immediately rehab the patients. In meniscus repair, it is very limited ideal indication which we should follow, and the patient should be very well mobilized for rehab, otherwise the chances of failure are high. Thank you.